Well, kia ora tātou, everybody. Bruce Arroll's my name. I'm the director of the Goodfellow unit. And our webinar tonight is on postgraduate study, what are the possibilities? So we've got a range of people who teach in the university in their various courses. There'll be Felicity Goodyear-Smith, who's the Goodfellow professor. She will be talking about the various structure of courses, and we'll be finishing up with Professor Chris Bullen, who will talk about public health options. So for those of you interested in public health, he'll be on towards the end of the evening. So our first presenter is Marion Roberts. She's a senior lecturer and a clinical psychologist, and she runs the two mental health papers, one on adult mental health and the other on child and adolescent. The adult is run in the first semester, and the adolescent one is in the second semester.
Kia ora koutou katoa. My name is Dr. Marion Roberts. I'm a clinical psychologist and senior lecturer here at the University of Auckland. I'm just going to take a couple of minutes to talk to you about the two postgraduate courses in mental health for primary care that I run here in the Department of General Practice and Primary Healthcare. Okay, so as mentioned, so I do work primarily as a clinical psychologist. I'm 4 days a week running a private practice in Parnell, and the other day a week I work at the university in my academic capacity, both supervising postgraduate students with their research and also teaching the following two papers. So the first paper I'll talk about is POPL-Prac 702, called Adult Mental Health and CBT Skills for Primary Care. So this is offered in semester one, so starting with us early in March. This course, the content really focuses on firstly access and inequalities that we see in terms of mental health care in New Zealand, and then primarily the bulk of the course is spent talking about common mental health presentations, both in order to upskill primary care clinicians about how to identify, how to assess, and how to provide primary care level intervention for some of these presentations as is appropriate. The course is delivered largely online. There are readings which can be accessed through our Canvas platform. There are recorded seminars and lectures and videos to go along to make that learning varied for you. And then we also have a block teaching day, so 2 block teaching days that are run on campus. And these have a really practical focus. So for these 2 days, my main aim is to give students really solid foundation understanding of some of the core principles of cognitive behaviour therapy, and also some skills around competently delivering some base interventions with clients in session that really sit within that CBT family of skills. So that will focus largely on kind of mild depression and anxiety presentations, but also something that you can use with those clients if they are, for example, set on a wait list for mental health services elsewhere. So the assessment for 702 consists of 4 elements. The first is a test, which is run about a month into the course. This is an online test, and it's focused on the readings in that front part of the course. It's multi-choice and short answer and worth 20%. We then have a small case exercise, and this is done with reference to a patient of your own from your practice to really practice those practical applied skills that I'll be teaching at the block course days. And the final piece of assessment is a large case report, where the case for that will be your choice from around about 3 vignettes that I'll provide. And that's worth 50% of the grade. The last 10% is about online participation and taking part in those discussions of readings with the rest of your classmates on Canvas. So that's POPL-Prac 702 starting semester 1 next year, adult mental health care in the primary care setting and CBT skills. So the second paper that I run is POPL-Prac 754. So this is in semester 2, and this shifts the focus from adulthood into that infant, child, and adolescent space. So content focus here, for example, is things like infant sleeping problems, postpartum depression, childhood anxiety, eating disorders, non-suicidal self-injury, and depression, suicide amongst teenagers, and substance use amongst teenagers as well. So much similar to the other paper, this is largely taught online through readings, through recorded seminars and lectures and videos as well. And then we again have 2 block teaching days on campus. These do have a practical focus, but these are run both by lectures from myself and some guest lecturers who are clinicians from the wider mental health sector that come in and talk to us, for example, early intervention psychosis, to name one of them. So assessment for 754, again, has 4 elements, but it's very much case-based assessment. So you'll be given a couple of vignettes and given some specific short answer questions to respond to for each of those vignettes, which draw from your learnings, again, about identification, assessment, and ideal treatment pathways for those presentations. So there's an assignment for the child vignettes, and another similar assignment for the adolescent vignettes. And then there is a case-based essay, which again encourages you to apply your learnings to a patient from your own practice. And finally, we have 10% of online participation, much as the other paper, a discussion of readings and your involvement in that on the Canvas site. Very happy to answer any questions anyone might have about these 2 papers. You're welcome to email me directly, or for any admin queries, you can contact our course admin, Upendra. Thank you for your time and hope to see some of you on the course.
So it was Marion Roberts on the mental health papers. Just so we know, if any of you are interested in 702, we've got 4 Goodfellow scholar positions where we can reimburse you for the cost of your papers. It's about $1,300 for a 15-point course. So if you email me, bruce.arroll@auckland.ac.nz, I can talk to you about how that can be accessed. Our next speaker is Ruth Choi Lee, who's a lecturer in palliative care. She's going to talk about the palliative care course. Over to you, Ruth.
Thank you, Bruce. Kia ora katoa, my name is Ruth Choi Lee. I'm a course director for some of the palliative care papers we offer at the University of Auckland. Thank you for having me to talk to you about these options for you, and I'll take you through this little short presentation. So I'm sure this is a bread and butter for many of you guys, but what is palliative care and why is it important for you to indulge in this field of practice a bit more? The word palliative comes from a Latin word pallium, which is a wraparound service, a cloak of care. So in palliative care, we try to equip you to provide that wraparound physical, psychosocial, emotional, spiritual support to your patients and family that you'll be seeing. And why is it important? Because we will all face end of life at one stage, and your patients and family will do it the same, will do it as well, as no one's immortal. So these are the 4 palliative care papers that we offer at the University of Auckland. So these are all 15 points per semester currently. However, we are planning on offering these as 30 points per semester from next year. So the first paper, Popul Health 746, Ethics, Culture and Societal Approaches to Death. And this paper will cover a lot of ethical issues that you might face as a clinicians or your patients and family might face as well, especially with the End of Life Choice Act now. I think it's essential that all health professionals equip themselves with these matters. We also cover different cultural approaches to death, such as Maori to Pacifica to Chinese, different Asian. So you are aware and equipped to provide the appropriate service or refer to the right people for those. And Popul Prac 720, the next paper, Psychosocial Issues in Palliative Care, you would understand there are a lot of psychosocial comorbidities that patients facing the end of life. So we can equip you to identify these needs and understand these needs to support them in their journey in end of life. The next paper is Popul Prac 722 and Popul Prac 720, Symptom Management and Palliative Care and Advanced Symptom Management and Palliative Care. These two papers are run by my other two colleagues, Elaine Rogers and Oleg Kriaf mainly, with different guest speakers. So these cover the various different symptom management of pain, nausea, such as dementia, different therapy to provide support. So the strength of these program, we have strong academic foundation, giving you the evidence base for your practice. It is tailored for clinicians, and lecturers are regarded as experts in their field. So different physicians or different professions will come in to make the lecture days interesting, to give you the kite, the skills. And the courses are taught in a very flexible and seminar format, like Marion talked about before. We have 2 to 4 block course teaching days each semester, so you wouldn't have to use too much of your study leave to come out to the campus or attend the online lecture in the case of lockdown or restrictions. So as we will be changing these papers as 30 points from next year, if you do 2 of those palliative care papers, you could get your certificate within a year. If you would like to get your postgraduate diploma, you would have to do 3 papers of those palliative care paper, plus a 15 points research and a 15 points health paper, giving you 2.5 years to graduate with diploma, and you could continue on with your further studies. So that's it for me. Feel free to email me for further questions or would like to know more, or follow the link. Thank you.
Our next speaker is Vanessa Selak. She's a public health physician, senior lecturer in epidemiology and biostats, and she's going to talk about the quality papers in healthcare. So over to you, Vanessa.
Thanks so much for the introduction, Bruce, and thanks so much for having me on here. That's my email address. Please feel free to contact me if you have any questions. I'm really happy to help answer your questions about the 2 things I'm talking about. One is our quality in healthcare paper, and the second thing is our digital health program. First of all, the quality paper. This is a paper that I teach, and it's really focused about providing you with some skills and strategies to address QI problems in the setting in which you're working. So what we do is the program is delivered online in weekly modules, and you can, to some extent, sort of pace the course to your, depending on your work schedule and your other commitments. So we're trying to make the course as flexible as possible. To supplement the online material, we also have some live sessions on Wednesday evenings, which are also recorded in case you're not able to attend live. In terms of the way that you get assessed for the program, it's through mainly through assignments where you actually get to apply QI skills and knowledge into various situations. The first 2 assignments, you can pick your own topic, essentially your own scenario, to focus on a safety issue or a QI project. The middle project is one where I give you some data to develop an interpreted run chart. But the focus of the course very much is on supporting practical applications of skills in the healthcare context. So we really welcome people from general practice, from primary care, such an important part of our healthcare system, and we do have strong representation from people working in primary healthcare in our program, as well as from secondary healthcare, to provide a really good overview about potential application. And the other nice thing is that you get a chance to not only learn from the lecturers, but also to learn from the other participants on the program. So that's quality. So please feel free to get in touch with me if you have any questions about that. And that particular paper can be done in a number of programs. In addition, I also want to talk about our digital health program, of which I'm the program director. We've got a really awesome team of teachers with a real range of skills from academia and also applied skills in our healthcare system, people who are working in the healthcare system at the moment who are delivering digital health programs and innovations. As you're probably aware, digital health is one of the key platforms for healthcare delivery. It really came out strongly as an enabler in the health system review. I'm personally really excited about the opportunities that are going to come from from Health New Zealand, from the Māori Health Authority, and really see that there is a lot of opportunity in digital health. So what you might find is that in your work in primary care, you might find that you have already started to work in roles that have a digital health interface, or you might find that this is an area you're wanting to get increasingly involved in. So we have a postgraduate certificate and diploma focused on digital health, as well as papers that you can do to supplement other training that you're doing. But essentially it's to provide you with some skills and strategies so that you can to support you to design, develop and evaluate digital health innovations to ensure that they are going to support improvements in health outcomes and equity. The whole program is designed to be undertaken flexibly, part-time. It's very much designed for people who are working within healthcare at the moment, and very much with a strong focus on clinicians. In terms of our postgraduate diploma in health sciences in digital health, these are the papers that you complete as part of that program. And for a postgraduate certificate in health sciences and digital health, you need to complete 4 courses. The core course, of course, is Principles of Digital Health, and then you can choose, you've got some choice in the other papers that you complete. So please feel free to contact me, v.selak@auckland.ac.nz, if you've got any questions about postgraduate training and quality or on digital health. If I don't know the answer, I will find the person who does. Thanks, everyone.
Okay, our next speaker is Associate Professor Janet Fanslow. She's the Chief Advisor for the New Zealand Family Violence Clearinghouse, and she's going to talk about her courses.
Thank you, Bruce, and kia ora koutou to those of you who have joined us this evening. I am delighted to have the opportunity to talk about these and the courses we offer in violence prevention. I draw your attention in particular to the website link there, which is, I'll show you again at the end, because it is a place where you can get a lot more of the nuts and bolts information about the violence prevention courses that we teach. But I wanted to take a slightly different tack with you, because I think often I am faced with questions about why is violence a health issue, and really why should we be concerned about it. And so I wanted to just remind you really about some of the challenge that we're facing in the field. Really about thinking about just how common some of the issues in violence prevention are that we're facing. And I think it really still is a bit of a eye-opener for many people when we talk about some of the statistics. About 1/3 of the population of New Zealand women will experience physical or sexual violence in their lifetime. And I say that partly because it's a reminder that it's not a question of, will you ever see women who are facing issues of violence in your practice? It's the reminder that you already do. And that as we are learning more about the substrate of violence, not only the commonness of it, but how it interacts with people's health. There's increasing research really about how intimate partner violence is actually one of the core risk factors that is underpinning a lot of many of the disease burden that we're seeing for women in New Zealand and Australia, and indeed around the world. And so when we look at what the World Health Organization is talking about in terms of some of the health fallout of the experience of intimate partner violence, we come up with lists of things that you probably see in your practice setting all the time, okay, in one way or another. And so I raised the issue about the importance of studying violence prevention, about really this is an opportunity to come and learn a little bit more about not only how it affects, at the disease and death angle, but really some of the pathways by which that occurs, how it influences high-risk behaviors, and some of the earlier points of intervention that we might be able to offer. And so the courses that we're talking about, we have opportunities to explore those issues And you can use the practically guided assignments not only to get an understanding of how common these issues are in the population, but to really delve into what are some of the solution-focused responses that we can make, not only to violence in the acute sense of, is it happening now? Is this an emergency? But how might we help people to deal with the historical fallout? So the course that I teach is Population Health 769. It's running in the first semester for this year. It's taught over 6 days total, 3 sets of 2 days, 3 different times over the semester. All of the assessment is internal, which means that you can focus it toward issues that you are particularly interested in exploring. You can find out some more again by going to the website link, and I'm happy to put my email address in the question and answer box, and happy to take other questions and respond to you individually or later on in the session. Thank you.
Thank you, Janet. Our next speaker is Associate Professor David Newcombe, who teaches drug and alcohol. David, over to you.
Thanks, Bruce. So kia koto, it's really great to be here and talk to you about some of the offerings we have around addictions and population mental health. As Bruce was saying, I'm the Associate Professor in Alcohol and Drug Studies, and I'm also Head of Social and Community Health, which I guess is a bit of an unusual unit in the School of Population Health, because we're a bunch of social scientists teaching into our programs. And we offer a number of courses and programs, especially in addiction, population mental health, health promotion, and as an interpersonal family violence, which you've just heard from Janet about her courses. We've just recently introduced a Master of Health practice, which allows clinicians, should they want to specialize in any of these specialty areas, so particularly addiction studies, population mental health, and health promotion. So as you can imagine, across all those programs, there are a lot of papers. So I've just chosen a few to talk about, which we thought might be of more interest or increased interest to primary care practitioners. But to be aware that particularly in the addiction studies area, it's possible to graduate with a postgraduate certificate or diploma, or go through the master's specializing in addiction studies. And some of you may be thinking that might be an area you'd like to specialize in. So please get in contact and we can talk a bit about the programs. So the core papers, which I'm not going to talk about today, do cover therapeutic skills, public health aspects of addiction, and assessment and intervention. But I've chosen the 2 papers that are in front of you because I think, as I said, they are a nice snapshot of management or of addiction, people who have addictions, particularly with the first one, which is the biology of addiction, takes a bit of a focus around the neurobiological factors that we think predispose individuals to addictions, and particularly a management focus around some of the pharmacotherapies that you may be using to work and manage with people who have addiction problems. We do have in that course, I run that course with expertise coming in from people like Professor Bullen and Natalie Walker, but also Karina Walters, who's a specialist pharmacist. The next course is PoplePrac 765, which is a coexisting problems course. And this is taking a focus on people who have coexisting issues around both addictions and mental health problems. And we do certainly do an overview of management of these people with these issues. I co-teach this course with a colleague, Dr. Rodrigo Ramallo, who's a psychiatrist by training. And so, I think with both of these courses, you can get a really good snapshot of working with patients who have addiction issues. I'll move on now to talk a bit about some of the population mental health offerings. So when we're talking about population mental health, a little bit different than the courses that Marion was talking about earlier. So these are courses that focus on promoting mental health across the whole population. So these include groups who have and may be at risk of developing mental illness. So again, it is possible to graduate with a postgraduate diploma or master's qualifications in this area. But I've chosen 3 courses, one of which is called Mental Health Development, which is offered in the first semester. And this really is helpful for those who are wanting to understand how to develop and deliver and evaluate interventions for health behaviour change. The second is Mental Health Promotion, which in fact Janet Fanslow coordinates and teaches. This is really about how we could design communities and societies to raise mentally healthy people rather than providing therapeutic responses after people develop problems. And so in that course, Janet will discuss themes such as social inclusion, elimination of violence, and elimination, and basically some very topical areas, of course, in our modern world. The last one is project planning for lifestyle change. And this focuses on planning and developing interventions aimed at addressing lifestyle issues, such as alcohol and drug consumptions, obesity as well. So I'm hoping you'll find some of those interesting. If you do and you want more information, please don't hesitate to reach out and contact myself for information around addiction programs, Dr. Sarah Fortune for mental health promotion programs. And I've also included a link there. I haven't had a chance to talk a lot about the health promotion program, but you may want to reach out to Professor Simon Kumar, who also is in our section. So I'll leave it from there and move on. Thank you, Bruce.
Thank you, David. As primary care clinicians, we've got a soft spot for social scientists because we see a lot of psychosocial stuff, and addictions, of course, is huge in primary care. So our next speaker is Professor Felicity Goodyear-Smith, who's the postgraduate professor of postgraduate studies. And she's going to talk about the various arrangements of papers and certificates and diplomas and masters, etc., that you can put together these papers. So this is going to be very handy because it's going to be everything sort of in one place about how to put your courses together. So Felicity, over to you.
Thank you, Bruce. Okay, so kia koto. First of all, I am going to talk about very briefly one of the courses that I direct, which is a very generic course. It's called Evidence for Best Practice, Population Health 709. And this is a paper about how to find and understand and appraise evidence in the literature. And then having got the evidence to see, does this whether apply in the context of your own practice? This course has been delivered online for a long time, and it's mostly asynchronous, which means you can do it at the time and the place that you choose. It runs in semester 1 and it's 15 points. And the assignments, there's 2 assignments and two tests or examinations for the assessment. So that one's starting this semester, a very popular course. But what I am going to talk about mostly is about the postgraduate study, particularly in our School of Population Health, just to give you an idea of the various structures of our courses, our postgraduate qualifications. So as you've already heard, that courses can either be 15 or 30 points. Most of the courses in our school are 15, but some, just like palliative care, are moving to 30. A 15 point is equivalent to 150 hours of study, and of course 30 points is double that. But this includes the lectures, the tutorials you come to, the reading, time for reflection, for completing assignments and for preparing for an examination. Now, if you just choose to do one course, as a standalone, you get a certificate of proficiency, but you don't get any qualification at all. The College of Urgent Care does choose to do this. They require their registrars who are going for a fellowship to do 3 certificates of proficiency. So if you are one of those, be aware that you're only going to get 3 certificates. You're not going to get any postgraduate qualification. However, if you do 4, or at least if you do 60 points, which might be made up from 4, 15, or any combination from 30 or 15, then you get a postgraduate certificate in health sciences, a PG Cert HEC. And that's a qualification. You can either do that 4 courses, 4 15-point courses over half a year full-time, or you could do it part-time over 2 years. So you might just do 1 course a semester for 2 years. And as you've already heard, some of these you can just get a postgraduate in health science, but you can also do a specialisation. It's usually a program of related courses that comprise a half or more of the qualification. So Ruth was telling you about palliative care. You can do a specialisation in palliative care. You can do a specialisation in infant, child and adolescent mental health. As David said, you can do one in alcohol and drug studies. Vanessa was telling us about digital health. The others are in different parts of our faculty, but they also might be of interest to you. So that's postgraduate certificate. Postgraduate diploma is double that, so it's 120 points. You need to have 15 from an approved list. For instance, population 709, the one I just told you about, is one of the approved ones, is more of a generic paper. And then you get another 105 points from advanced level courses from various papers that are listed in something called the Master of Health Sciences schedule, available on the website, and I will give you that link at the end. So you can do this full-time, in that case it'll be a year, or part-time up to 4 years. And again, you can get specialisation in palliative care, in infant, child and adolescent health, primary mental health, alcohol and drug, digital health. So all of those, and a number of others, population mental health David talked about as well. And you can do one in Pacific Health as well. So that gives you not just a postgraduate diploma, but it's a specialisation. So, okay, so once you get into postgraduate study, you may not want to stop at getting a postgrad diploma or certificate, and you may be looking at getting a master's. And there's basically 2 sorts of masters. It's either a taught master, which really means that you do the masters who are doing mostly coursework, or a research masters. So a basic master's in health science that's taught, it depends on whether you already have a PG diploma. If you've already got a 120-point PG diploma, generally, if it's a recent one, you could enter and just do a 120-point taught masters. And that means you do another 2 courses, or 4 courses at least, or 60 points, either 15s or 30s, from the Masters of Health schedule. And you do a 60-point, either a dissertation or applied research project, and that'll give you a taught masters. If you haven't already done your 120-point postgraduate diploma, you can go directly to a taught masters from an undergraduate degree by doing those original 120 points, as we mentioned, and then the other requirements on top of that for the taught masters. So that's a taught masters. However, you can also do a research masters. A research masters, again, it's the same criteria. If you could go directly into it, if you've got your postgraduate diploma of 120 points, though as I say, there are some conditions. It has to be a relevant and a recent postgraduate diploma, or you can do that first. But instead of doing more coursework, you do a 120-point thesis or a research portfolio. So it's much more about doing research than just doing courses. So that's why it's called a research master's and not a taught master's. And so you either do a 120 point, or you could do a 90-point research portfolio, which is a smaller bit of work. And then to get the extra 30 points, you do that for more courses from the master's schedule. So I hope that all makes sense. But that's the 2 sorts of masters in health science you can get. But there are other masters. David's already mentioned to us the Masters of Health Practice that's newly been introduced. So this is community-based and practice-orientated, particularly for people who want to go into careers in health promotion and addiction and areas like that. So it's probably for GPs, probably not going to be most suitable of masters, but it's nice to know about it. It might be a possibility. There's the Master of Health Leadership, which could certainly be useful for GPs and nurses, particularly if you want to go into some, some leadership in the PHO or the DHB or whatever they're going to evolve into once we get, our new reformed health system. But health leadership, there's an increasing number of roles in there. And it's 180 point, and it's a taught master's, 120 or 180 point, but it's, you do a project, but it's not the same as doing a master's thesis. And then of course, there's also the master's in public health. And there's a whole series of courses where you can do a certificate, diploma, and then masters in public health. And again, that can be either taught or research. And we've got Chris Bullen following me, who will be able to tell you more about public health qualifications. So finally, of course, you can go all the way and you can do a doctoral study. And particularly for GPs, that's probably most likely to be a Doctor of Philosophy, a PhD, where you do a supervised thesis on a topic of your interest, with usually a couple of supervisors to help you on the journey. And this can be either 3 years full-time or 6 years part-time. So it's quite a commitment, but it is also a very enjoyable thing to do if you're that way inclined. You can get a Doctor of Medicine, an MD. That is, again, it's a supervised thesis, but in that case, you already need to have done some research and have published it and have a body of research that you then write a thesis about. And there is also a Doctor of Health Sciences, which is a combination of taught courses and thesis, but mostly GPs would be looking at a PhD. And you need to meet some entry criteria, but Associate Professor Stephen Buteau, who's named there, very, very helpful, directs our doctoral program, and he can inform you all about those. So that's a sort of in a nutshell what the sort of study you can do postgraduately. You can start off small and just build and build and build. It's exactly what I did. I did one course originally, never planning an academic career. And then I thought, oh, well, I may as well keep going. Ended up with a master's and eventually ended up as an academic. So I called myself an accidental academic. But I'm very happy to be contacted, answer questions. You can ask Chris, who's coming, about public health options. And this URL here, the website, really is the best place to go to find out about the options for our School of Population Health. Thank you.
So finally, we've got Chris Bullen, who's a Professor of Public Health and head of NIHI, which is the National Institute of Health Innovation, and also a public health physician. And he's going to talk about public health, which has become enormously popular. Chris, you're getting floods of applicants.
Okay, we hope so. Thanks, Bruce. Great. Okay, well, look, yeah, as Bruce said, you would have been hiding in a cave somewhere if you hadn't heard about public health recently. And of course, some key spokespeople who are both medical graduates who had a career in public health, one in public health sector at the kind of management and leadership level, Ashley Bloomfield, and then Michael Baker, both Auckland graduates, I might add, now based in Wellington. And Michael's gone down the academic epidemiology route. Felicity's laid a great groundwork explaining how our postgraduate courses tend to be structured. And the public health program that we run at Auckland is really no different. In other words, you can start with individual courses, you can build up to a diploma, which is 120 points of courses, and then you can add on to that and go for the master's, and beyond that with postgraduate, PhD, and so forth. We only offer a certificate in public health as what we call an exit qualification. In other words, you enroll for, at a minimum, for a qualification at a diploma level. But if you choose not to continue, but you've done 4 courses, you can get a certificate in recognition of the work that you've done. So essentially, the postgraduate diploma in public health is 1 year full-time study, 8 15-point courses currently, although there are a number of courses moving through a very slow process to perhaps double their point contact. And then there are a whole number of core courses that you have to do, and then those are foundations, and then you can build elective courses on that. So the core courses include some of the ones you've heard about, the one that Felicity mentioned about evidence in clinical practice is one of the options. You can choose an epidemiology option, Public Health 708, instead of that one. And then there's Māori Health paper, which Foundations in Māori Health, which is an excellent paper to come to terms with all the issues and challenges and ways of thinking about Māori health and Māori health delivery in Aotearoa, New Zealand in the 21st century. And then we have a research paper that everybody has to do, and the Foundations in Public Health course, which is an introduction. And then I teach what we call a capstone course, which is about public health in practice. But in the mix of other options, there's a huge range of courses that people can do. Now, if you're going down the training as a public health physician, having been a general practitioner and maybe been involved in the COVID response and thinking, this is really interesting, I'd like to learn more, then many people are choosing to apply to get into the public health training program, which is a post-basic training specialty area, which Vanessa, Bruce, and myself, among others, at the school have gone through. And the College of Public Health Medicine in New Zealand mandates, dare I use that term these days, a number of courses. In addition to our core courses, they have some other requirements such as environmental health, health protection, relevant to public health practice. But if you're just going your own way and forging your own path, it's very, very diverse and fascinating, because you get to rub shoulders with people from all walks of life, not just the medical profession, but right across the health specialties, but also people from backgrounds in overseas aid and development and different social sciences. We've had actuaries and people in management roles and all sorts, and it just adds a real richness and expands, blows your mind a little bit. And it can be very challenging, having been indoctrinated, for 6 years as a medical student and then with your postgraduate training, to think that doctors have, a handle on everything. And of course, big picture public health is zooming out to see, what's going on in terms of preventing disease, promoting health, and prolonging people's lives and reducing health inequities. So it does stretch the mind somewhat. And I found it to be one of the most exciting times of my life doing my Master in Public Health and building on a background in clinical practice for over a decade before I did it. So you're never too rusty to embark on postgraduate studies, and public health is a great place to start. So you can add on 1 year to the postgraduate diploma and do the Masters, which, as Felicity said, for the health science is just the same. It can be taught with a dissertation, plus 4 15-point courses, or it can be a 120-point research thesis, which is 1 year full-time, or over a couple of years, you can do it half-time and blend that with your clinical practice. And of course, the way we run our program has been adapted over the years to align with your busy lives. And I was doing general practice and doing my postgraduate diploma in public health part-time, studying in the evenings and weekends, struggling a bit because in those days they ran the courses several times a week for a couple of hours. But now what we do is run them in block sessions, and it's much more convenient for most people to take a Friday off and to be able to get away for the day and focus on that. And of course, in these COVID times, a lot of that delivery is now online, so it's even more convenient in the sense that a lot of our courses are available online. If you miss the live session, you can always go and catch up, and we record all our teaching sessions, and a lot of the course content is now delivered in a hybrid way or completely online to make it as flexible and adaptable to our changing times as possible. So you can do majors in population health, stroke public health, digital health, as we've heard, health management, leadership, Māori health, population health practice. And look, I'm not expecting you to look, and we're not going to go through these one by one, but this is just, you know, on the menu. It's like a restaurant menu with many, many different options, from health economics to, you know, tobacco control, qualitative health research methods, population youth health statistics, cost effectiveness evaluation, et cetera, et cetera. So I guess the main thing is it's a bit bewildering, but hopefully this evening you have got a sense of all that we do have on offer, that we are pretty passionate about what we teach, and we love mixing with students, especially mature students who are highly motivated, very conscientious to do well, and usually do exceedingly well in their studies. So it's a real joy and a privilege to work with our postgraduate students. So please talk to us about your goals and what you're hoping to achieve, and we can help to tailor make and individualize a study plan that hopefully can fit in with the rest of your lives and make this a really pleasurable and immensely rewarding experience for you. So feel free to email me about any of the things that I've talked about this evening. Thanks.
Great. Well, thank you very much, Chris. Okay, I'd just like to thank everybody, and just to remind the audience that these folks have put their email addresses up, and if you want to find out more about their courses, feel free to email them. I'd just like to thank you all for coming on tonight. This will be recorded and available for future, so if you want to have a look at it again, you can. If you've got colleagues who want to do some of these courses, put them on and let them have a look at the, let them know the link. It'll be on the Goodfellow website for at least a couple of years. So thank you very much, everybody, and good night.